This is another true story that I hope will help you and I to get on a healthy path, to remain on a healthy path, and stay away from drugs that have so many negative side effects. You see, my friends, food cures, and natural remedies always work. They've worked for thousands of years. Okay, thousands of years when our foreparents would live very long, healthy, meaningful lives, and they didn't have drugs to take for their different ailments. So here's a true story that I want to share with you that I hope will help you to give your body the right tools so your body can heal itself. So like I've shared before, my dad has enlarged prostate. It's very common in Jamaica where he's from. I'm not sure the exact reason. Could be dietary, I don't know. But my dad's 85 and he has enlarged prostate. One of the things that tend to bother men with enlarged prostate is that they get urinary tract infection. And that's because they're usually not emptying their bladder sufficiently. So the retention of urine in the bladder, the fact that the bladder is not emptying itself, the urine kind of stays in the bladder and eventually develop an infection because they're not emptying their bladder properly. Another thing is that because of the swelling in the prostate or the swelling of the prostate, they retain urine and they can't urinate at all, and so the urine can back up into the kidney, sit in the bladder, back up into the kidney, and can cause severe infection in the bladder and also in the kidney. So 3 weeks ago, my dad called to tell me that he could not urinate. Whenever he tried to urinate, it would just trickle, and he was having severe pain and severe burning. He was crying when he called me. And my dad lives by himself and he's very self-sufficient at 85, and he's not a crying kind of guy. He was crying because of the severe burning, severe pain, and the fact that he could not urinate. No, my dad has had to wear a urinary catheter all the time. He did for a few years, but I think it's probably about 5 years ago that they removed it because he was doing well and he's not had to wear the urinary catheter. And he was more worried about the fact that they would have to put the catheter back in. It was so painful and he hated it so much. So he was more worried about that than really the fact that he was suffering from this obvious urinary tract infection, because he told me he was also having tremors, ague, and fever and severe pain. The long and short of it is that he went to the doctor and they suspected he had a urinary tract infection. They sent him to do some kind of a test. He wasn't able to tell me what it is. And they gave him antibiotic and pain medicine. Well, that didn't really relieve the issue or get rid of the issue. He still couldn't urinate, just trickles, he said. My dad's immediate neighbor of about 55 years is a retired nurse in her 80s. And he told me that he called nurse to tell her what was going on. And she told him to put hot water in a basin as hot as he can tolerate it. Not so hot that it will burn you, she told him. And you should sit in it for 15 minutes to half an hour, twice a day. She also told him to get some cranberry juice and coconut water, mix it together and drink a cup of it in the morning and a cup of it in the evening. Well, my dad said the first time he used the hot water, I guess that would be a Sitz Bath, right? First time he used it, and along with drinking the glass of cranberry and coconut water, he said he urinated half a gallon. It was dark. Yes, it was still painful and burning, but at least he urinated. And the next time he urinated the same amount. Well, it's been 5 days now since he started using nurse's protocol, and he has no burning, no pain, and no urinary retention. Now, you might say, well, it's the antibiotic they gave to him. They had given him antibiotic for 3 days. And after the 3rd day, he called me and he told me the problem was the same. He was still having severe pain. He was still having severe burning, and he still could not urinate properly. It was just trickles. That was the 3rd day after he had finished the antibiotic. And he said it was after he finished the antibiotic and nothing was happening that he called nurse and she gave him her recommendation. Yes. Natural remedies, home remedies, food does help. Okay? And that antibiotic, whichever one it is, I know has a lot of negative side effects. So I didn't really want him to take it anyway, but you know, I'm in the States. I wasn't there to guide him and help him to use natural remedies. And sometimes, you know, the things I'm not totally anti-drug, because sometimes, you know, they serve their purpose. If that had helped him to get relief and to clear up this issue, I would have been okay with it. But even after taking antibiotic 3 times a day for 3 days in a row, he had had no relief. And yet this remedy that this nurse gave him, is elderly nurse who is used to home remedies, who practiced nursing in a time when you could recommend home remedies to your patients. She gave him a home remedy that worked like a charm. And he called me today happy, light-spirited, and feeling good. He told me he went back to the doctor, and the doctor said he had a urinary tract infection that they detected in the urine test, and gave him more antibiotic and pain medicine. And this is what he said to me: I am not going to take them. I will continue to do what nurse told me to do, which is drink cranberry juice and coconut water. He said I'll do it every day to prevent this problem from coming back, and I'll continue to do the soak. What she told him to do is put the hot water in a basin and put some salt, okay, and not too hot to burn himself, like a Sitz Bath, and to do it twice a day. And he said he would continue to do that. So, you know, coconut oil has a whole lot of antibacterial, anti-inflammatory benefits. And I researched why this coconut water that she told him to. And I saw where coconut water is a natural diuretic. So for folks with prostate issues, it forces the person's body to diurese and get rid of that excess urine. And also coconut water is a natural anti-infective. And of course, I think everybody knows that cranberry juice has a natural anti-infective, and it's very acidic. Not acidic to bother us, but acidic enough to destroy bacteria, etc., from the urinary tract. So I wanted to share that with you. Okay, remember, our food is our medicine, and our medicine is our food. And negative side effects from drugs, not medicine now, drugs, is one of the #1 killer in the United States. Bear that in mind. God bless you, and you take care.